Welcome back. This is still Tea or Coffee on High Impact Television. If you're just joining us, welcome, welcome, welcome. It's good to see you. Ensure that you follow us on all our social media platforms at High Impact TV, at High Impact TV UK, and at Watch Tea or Coffee. So the conversation this morning has been on wound management. And I mean, we've taken a case study that's quite sad. And the good thing is that we have an expert in the studio here to have this conversation with me on wound management. And his name is Timmy, and I'll be reading his profile. Timmy is a passionate physiotherapist who trained at the College of Medicine, University of Ibadan. He currently works with a serving member of at Lagos State Ministry of Health. He loves orthopedics and musculoskeletal aspects of physiotherapy, but also believes that there are still so many areas to explore. He has worked in the ICU and managed burns and similar wounds. Join me as I make welcome Timmy, our celebrity physiotherapist. It's good to have you. Welcome.
Yeah, thank you.
Yes. So now let us start with professionally establishing what wound management is, what it's about.
Okay, so wound management is, simply put, management of a cut through the skin.
Okay.
Like that is the easiest definition that anybody will understand, yes. So then moving deeper now, we are now talking about ensuring that the environment is safe for this wound or for this cut to heal. Like, so when we're talking about management, we're talking about ensuring that the wound heals and the environment and everything needed for that wound to heal is fine. That's the management part.
Okay, so are there different types of wounds that we should take note of?
Yes, basically we have open wounds and closed wounds.
Okay.
But most times when people talk about wound management, most times the brain just goes to open wounds, because I mean that's what you can say. Okay. But it's possible for you to have a wound in your skin and it's not open.
Oh, right. Please, can you enlighten us on that?
Okay. In cases where there is a trauma, somebody eats the skin. Okay. It's possible for there not to be a breakage in the skin,
outer layer.
But under, there's already inflammation, there is swelling, there is blood. And we have people who have, maybe they've had cancer or something over time. The skin is still fine, but they are eating. It's eating inside. So that's a closed wound. But an open wound is, okay, you have a cut, it opens, everybody can see there's blood, there's this. Okay, so how do we ensure that blood stops and all? So those are like two.
Interesting. So where does the difference between acute wound and chronic wound come to play, and how can it be treated?
Okay, so two words, acute and chronic. Acute means short time or something that just happened. Chronic means it's been there for a long time. Okay, so acute wounds are wounds that happen now and we can treat them, right? Chronic wounds are wounds that started acutely but did not heal. So it's been open. So I'll be focusing on open wounds major. So it's been open for a long time. So it moves from acute to chronic. I think within any wound that doesn't heal within 4 to 6 weeks is termed chronic.
Chronic, 4 to 6 weeks. 4
to 6 weeks, most times it's termed chronic. So acute is, it happens, and while it happens, okay, we've started the management to heal it and it's healing. Chronic, we've done everything we should do, or we didn't go to an hospital. I mean, some people do not go to an hospital and till it gets worse and worse, then later they now bring it to the clinic that, oh, I have this one. And by then, there's not much. It's not that it can't be managed, but like the chances are reduced compared to if we started managing it initially. Yes. Okay, when it comes to acute wound, what are the first aid measures that you can use to treat it immediately? First aid measures, we don't want, when it comes to wounds, the biggest enemy of a wound is infection. Okay. Like anything that you do to a wound, ensure that it doesn't get infected. Even if it's a chronic wound, ensure that it doesn't get infected. How can you ensure that it doesn't get infected? We have three orifices to the body: the eyes, the mouth. That's why when we even had COVID, people were saying you could get COVID through your mouth. That's why I say wash your hands, because you can touch your eyes, your ears, or your mouth. So those things, those entrances to the body are protected. They are called orifices. But now, once we now have a cut, the skin in itself is an organ, and it's like the Superman of the body because it covers every other organ, and it's like the one that shields the body from infections. But now there's a cut, and we can't keep infections or the bacteria or all from coming in. And that is when, okay, the infection starts. So when it comes to acute management, we want to ensure that there are no infections first. And what are the things that cause infections? Dirt.
Okay.
So that's what we are using clean things. You are wearing gloves or you've washed your hands. All these basic first aid things that most people do not pay attention to. I remember when we play ball as kids and you just eat your leg on something and you now pack sand and you put sand on it and you're like, yes, let me continue. I mean, like, everybody did these things. And the reason why we survived, well, would be because most like our immune system was like optimal. So even though we sense the infections and put the sand, I mean, the white blood cells just go there and they're like, yeah, we are here. Where are we going? I mean. Yes, but normally, once you have a cut, you are just ensure, you want to ensure that it is clean. Yeah, you wear probably gloves or you wash your hands. You have a clean swab. You want to prevent blood if it's bleeding. You apply pressure to ensure that blood and the bleeding reduces and all. So.
When you said I applied pressure, it reminded me of something that was trendy one time. Apply pressure, apply pressure. Okay, so there's a case study, that we looked at before, you came on to have this conversation with us, and it's of a young boy. It's a true life story, actually did happen. So a young boy that was playing football, and he had an injury. A nail went into his leg. But, as kids now, your parents has warned you that you shouldn't play football. So he didn't want to tell his parents. So he kept nursing the wound by himself. And then for 2-3 days, he didn't tell anyone. The wound was swelling, And at the end of the day, he died. And the doctor said he died of tetanus. So can you explain that scenario to us? I mean, it's just a nail. Like you said, some of us, we've had that countless number of times and nothing happened. I mean, the pain just went and everything just went. Yes. So why did it result in him losing his life? Why was it that serious?
Yeah, that's a very sad story. Yeah, it's a true life story. When I was younger, whenever we eat our leg or nail, next thing is you are going to the chemist for tetanus injection. Wow. In my family. So we always do that. Whenever anybody just go, first thing you are taking is tetanus. I think I've seen my my grandpa put hot oil on nail before. And, so they'll put the knife inside the fire. When it's hot, they'll pop palm oil on it and they'll drop it.
Yeah, I think that's what the parents, his parents, when they got to find out, that's what they resorted towards. I mean, I think it was too late or something.
That thing is very painful. Wow. Okay, so this is the thing.
Okay.
The nail has punctured the skin. It's possible that the nail in itself was infected. It's worse if the nail is rusty. Do you understand? Okay, if the nail is already rusty, if it was a clean nail, it might not have been that bad. Yes. So that's the first thing. If the nail is rusty, we already have like 50% trouble. Okay. You get? So now, he didn't tell his parents. It must actually be a young person because the chances that tetanus will kill an adult is
slim.
Well, it's a bit slim. I mean, you've seen life. Your body has fought a lot of things. And most, I think now in Nigeria, children are given tetanus vaccine from childhood. And when you're an adult, the strength of your immune system is quite solid now. But so as a child, if the nail was rusty, then now tetanus is a serious bacterial infection actually. It's most likely the child also had fever and maybe was sweating at some point. His body got stiff. Yes, these are the things that you see with classic tetanus infection. And when we talk about infections, once it gets into the bloodstream, that means it's already, the bacteria is going around the whole body. So even if they found it out on time, they would have like put him on intravenous antibacterials,
Okay.
because I mean oral may not work well then. It has already gone
into
deep.
the system.
Exactly. So we have to use IV. Yeah, I think I've managed a tetanus case before. This was a young girl. I think she was about 8. When I started seeing her, because I'm a physiotherapist, when I started seeing her, she was stiff, and to even move the limbs, so much pain.
Wow.
Her neck was like this. She could not turn to the right or to the left.
Wow.
Yes. I'm not sure it was nail. I think she had a cut from glass.
Okay.
Yes, as
And
was
they
a
didn't
glass
pay
cut.
attention
And
to
they
it,
didn't pay
or-
attention to it.
Wow.
But she still survived.
Okay.
But it took a while to even get her back to working, while the doctors were always ensuring that. Now, the funny thing is the cuts had healed.
Interesting.
Yes, but the tetanus, the infection
still
was
in.
already in the system.
So immediately you have a cut, what is the step to take? What are you meant to apply? What are you meant to do?
Okay, so if we are doing first aid,
Okay.
it depends on cuts. If it is a deep cut, there are some cuts that you will see and you'll be like,
You have to see a
this,
doctor or
you have to
something.
go to the hospital straight up. They will ensure that they sterilize the place. As I said earlier, infection. So once the place is sterile,
Okay.
chances of infections are reduced. Healing is another process on its own. That's why even when you go to the theater, because you're cutting through the skin.
Yeah.
There's a place we call sterile area. You don't go. Nobody just goes in.
Okay.
Before the surgeon comes, the surgeon would have dressed you, glove up, wear your scrubs, your eyes, this. So, and once you go in, you don't come out with that.
Okay.
Because once you
take
ensure
it
that
out.
no infection comes into the place, because let's say we're working on the chest now. We've opened the chest. That you don't want infections to go into the body. So infections are like the worst enemy of any opening to the body. So once you have a wound, if you are at home and it's a small cut, you want to get a clean swab or cutting roll, ensure that your hands are washed, use warm water or very clean water, right?
Okay.
There are a lot of arguments about using hydrogen peroxide and all this, but use the warm water, clean it, put a plaster, or you can apply an antibiotic gel like penicillin.
Okay, I'll still come to that plaster and penicillin, but talking about the process of healing, why is it that there are some wounds that take longer time to heal than other wounds? There's some that you have to cut and then hours or the next day you can see it closing up already, while some it takes a long time. It just keeps you. I'm wondering what's going on. Yeah.
There's this Yoruba thing they say about wounds on the ankle.
Okay.
So I think kokose or something.
Kokose.
Yes, the ankle.
Yeah.
Most times wounds there take longer time to heal. That's like if you hit your ankle on something and there's a cut, it looks like you keep hitting your ankle. You just see that the wound keeps coming back. So I will explain why. In healing, blood is very important.
Okay, why?
Blood, because blood carries nutrients, and it's these nutrients that will help the skin to heal. So why some wounds? First, how deep is the cut? If it is, so we have the layers of the skin. We have the epidermis, we have the dermis, and we have the hypodermis. So hypo means under. So epidermis is outer. Dermis is inside. Hypodermis is like under the dermis. And most wounds in the epidermis will heal faster.
Okay.
Depending on where. So now let me explain how blood comes into play.
Okay.
Blood carries nutrients and healing factors. So we call them platelets. They are the ones that help in blood clotting. Did you do biology?
Yes.
Yeah, so
That's why struck a
platelets. Erythrocytes, lymphocytes, and thrombocytes. So the blood carries the platelets to the side, and they begin to work. They call it hemostasis. These are like medical terms, right? So there are like 3 processes. Then there's a process where the body is cleaning that place itself, putting white blood cells there, ensuring that infections do not come in. Now, the body in itself is self-defensive. That's the truth. We are created such that our body can in itself fight against infections and these things. But when it becomes too much for the body to handle, then there's a breakdown. Okay. Then after that, then we have the skin forming and the wound healing. But now, if you have a wound in this place, the shin or the ankle, you notice that if I hold your ankle now, I'll most likely be holding your bone.
Yes.
If I hold your thigh, before I can hold your bone, I'll have to press deeper. Why? We have more muscles here than here.
Yeah.
Good. Now, blood vessels pass through muscles.
Okay.
So any part that has more muscles will definitely experience faster healing because there is more blood supply than the part where we have less muscles. Do you understand?
Yes, I
so
do.
It's like, this is the explanation. So now when we now talk of parts of the body, the skin, the muscles will heal faster than the ligaments or cartilages. Why? Those guys, the ligaments I call it those guys, they do not have blood supply like muscles.
Okay.
And now if you are coming down here, we have mostly bones ligaments, So that's why even in football, like sports physiotherapy, once a footballer has an ankle sprain, it's going to be a long time. Like, because I had an ankle injury about a year ago, and I will tell you that even after 6 months, I still feel the pain.
Wow.
Yes. Because,
6 months.
Yes, after 6 months, I still feel the pain at the ankle. So, ligaments do not have blood supply like muscles do. So, ones that are where we have good muscles and good will heal faster. Now, that's provided all other factors remain constant. So that is like another conversation on its own.
I mean, it's elastic, and I know most people, this is news to some people. They do not know, but we just know that if I have an injury here, it heals. It doesn't heal faster. If I have an injury here, it heals faster. So what exactly is going on? Is it that something is wrong?
So that's like the basic explanation.
So that any part of the body that has more muscles will heal faster, more blood
cells.
Yeah.
In fact, the mouth is the fastest place that healing takes place. And another thing is because the mouth is moist. Okay, so apart from blood supply, moisture also aids and promotes healing.
Wow.
That's why we cover wounds.
I'm still coming to that.
I think I should not use we. I think I should, because physiotherapists do not exactly like cover wounds. Yeah, so that's why nurses cover wounds. That's why we cover wounds.
Okay. Now, so there's a popular belief that alcohol aids infections or aids wounds to heal faster. Is it true? Because here when you have an event that alcohol, you know, that kind of thing. So is it actually true? Does it actually help it?
Okay. How do I put this? Yes and no.
Okay.
Let me explain how. Now, you watch all these cowboy movies, or movies when they want to maybe or amputate someone. These old movies, right? What do? They probably cut off the hand and they pour whiskey. If you watch cowboy movies, they do it a lot. Or if somebody has pain, we are watching maybe Legend of Tika now. Did you see Legend of Tika? Okay, so let's say somebody has an injury, right? An arrow.
Okay.
And the other guy in the army, yes, they did into the army. They gave him a stick, a small stick to bite on. So while he's doing that, they get whiskey or something
and they pour
it there.
Yes.
You would have seen that.
I see that in movies, yes.
And they pour it there before they now tie something around it. Good. So now, two things are happening there. The reason why they're pouring whiskey there is to prevent infection. Now, this is a crude approach, but it is quite effective considering the environment where they are. Do you understand?
Yes.
So, I mean, they pour alcohol there. And what alcohol does is because, now even during COVID, everybody started using sanitizers and they say it should be what? Alcohol-based. Right, because alcohol kills germs. Do you understand? So that's like the explanation. But then again, I don't think it would be safe. I mean, let's say I have a perfume now. It's also alcohol with a lot of other substances. I won't advise you to pour.
So it depends on the type of alcohol that you are using.
Exactly, because even when we use methylated spirits in the clinic, right, it is alcohol-based. It's ethanol and all, but we are certain that it is pure. And it's not like adding other substances to it. So in a way, for preventing infection, yes. But I won't advise you to, maybe when you have an infection, and now take Baileys.
But will it have side effects though?
Don't pour Baileys on wound.
No brands. But let's move on. But does it have side effects when you pour like whiskey or anything on it?
Side effects, no, you just feel pain, which will most likely even subside after some time.
Okay.
Yeah.
So let's go back to that plaster conversation. So there's a popular belief that wounds need air to heal properly. And people don't believe that you have to put plaster on a wound because it will just be moist, like you said, and just be there and will not heal in time. Is that true? How does plaster aid wound to heal faster? And should we actually even use wound? Or are there types of wounds that need plaster and are there types that do not need plaster?
Okay.
Yeah.
Do people feel better when they cuddle?
Anna, I think so.
I mean, why? Warmth.
Yeah.
I mean, it feels so
the
nice.
Feeling.
Yeah, so I think that's how it is for wounds also.
Oh, okay.
And when you expose a wound to air, you make it dry. It gets dried over time. For some people, the arguments most people make is oxygen is needed. But the truth is the blood already has the oxygen needed for the wound to heal. So we do not exactly need external oxygen like the air.
Okay.
That's why when you want to dress a wound, you see they first moisturize the place. So wounds do not, I think, of recent now, medical journals of recent have actually changed the narrative. Wounds do not need air to heal. The narrative has been changed. I mean, if you check recent journals and recent publications, they found out that it's better we keep the environment moist, we keep it comfy to allow healing substances, inflammation. We want to reduce the skin breakage. I mean, if the skin is dry, even if you are just moving your legs, you feel pain.
Yes.
And you might end up breaking it again because it's getting dried.
Yeah.
But keep it warm, keep it moist, let healing take place, keep it disinfected while that is happening. That's why we use a plaster. Okay, so now some wounds need, I mean, there's some dressings that they use a lot of bandages and gauge this thing to pad it well. So that depends. If it's very deep, that might be necessary. Okay, there are even some wounds that they cut another part of the skin to put a layer of the skin on the wound. If they found out that chances that the skin will go on that place is slim. This is mostly done by the surgeon, plastic surgeons, yes. They do that a lot. Okay.
Interesting. Wow. All right. So
you could still take, I mean, second degree in medicine.
No, please. The sight of blood alone, it scares me. So I have like 2 questions for you before I let you go. Now this one is about when should people go and see a doctor? Is it immediately they have a wound, they have a cut, or they can resort to first aid at home, or should they immediately go to the doctor? Or what even type of first aid? Because like you said, people just resort to, let me put spirit on it and we are okay. I put plaster. They call it, there's one they say iodine and hair. You put on it. So enlighten us, what should they do? Okay,
safe space. You can do your first aid and go to the doctor.
Okay, so let's do both.
Yeah, that's safe space. You can do both. But then again, if you have a wound that you see and you're like, go to doctor while you are doing first aid. Like, while the first aid is going on, be on your way to the hospital, right? If you have a wound that you see and you're like, it's not so much. Okay, look at it. And then you look at the age, right? I mean, for someone that is an adult, geriatrics, when we talk with geriatrics, we talk about 60 and above. Pediatrics, talk about children maybe 15 and below. So geriatrics now we don't even know if the person has diabetes, because most times diabetes prolongs wound healing. Yeah. So once you see a wound in an elderly, to just be on the safe side, just take the person to the clinic. Let the professionals check. You can do your first aid, but don't keep don't party thinking, okay, it's just one of those wounds, because it might not actually be one of those wounds. But if the person is fine and you can note the history, maybe it's just a little cut and maybe it's not a rusted nail and all that. But safe space, do your first aid, go to the hospital.
I mean, in the interesting conversation, I didn't even want you to go, I mean. So there's some wounds that, you think that they are healed completely, and then you just do like this. And then you see blood again. Like, why is that? Does that mean that you still have to like wait or allow it to come? There's like an outer layer or so, allow it to come off itself, or you can aid it.
I don't know if, okay, I don't think it's female, but people like this of peeling. You see
Yes.
one and you want to peel it.
You just want to take it
scratch
off.
it and take it off. Yeah, but those things are actually okay. So what you should have done, even if you want to remove that, which I don't think you should remove, if you want to remove that, the best you have done is to make it moist. The reason why you see blood after you pull it off is because it's dry. Do you understand? Yeah. It's because it's dry. Most times that will still come off on its own.
On its own.
But you actually extend the wound if that place is moist. You're wasting the healing process if that place was moist.
Okay. So I have one little question. We need to go. But
Okay, no
this question is very important. I know we had it before we came live. We're talking about the difference between physiotherapy and wound management.
Okay.
What is, just in a few seconds, what is the most distinct difference?
Okay. So physiotherapy is all about movements.
Okay.
We don't want you to be sedentary. We want you to move.
Okay.
So when someone has a deep cut, or let me use a bones injury for example.
Yeah.
The bones injury is primarily being managed by maybe the surgeon, the plastic surgeon, and the nurses. But now if you just keep those bandages and everything there, and you leave the person there for 2 weeks, 3 weeks, the muscles become stiff. So while the person is there, even though there is pain and the person can't move, the physiotherapist comes in with our knowledge of wound management already.
Yeah.
We want to ensure that we can protect the little range of motion that the body can still give.
So it's like a symbiotic thing.
Exactly.
Hand in hand.
While the healing is still taking place, we are protecting it. Worst case scenario, if there is no professional around and something happens, we know what to do. Do you understand? But it is not like you won't exactly just go there and say, oh, I want to go and open this wound and start dressing it. Do you understand? So that's like this symbiotic relation. It's called a multidisciplinary team approach, and that's what medical practice is all about. Everybody does what they are supposed to do and when they are supposed to do it.
Thank you so much, Timmy, for enlightening us on wound management. And I'm sure a lot of people, I'm not the only one that is excited that I got to learn a lot of things about wound management, what part of the body heals faster and why we see it happen that way, and what to do when immediately you have a cut. It's safe to apply your first aid and then go and see a doctor just to be sure and to be safe. I mean, it's only one life. You cannot be joking with it. But thank you so much once again for coming to the studio to have this conversation with us.